Good afternoon, everyone, and thanks once again for joining us for Mayor Woodfin's Tele-Town Hall. We are going to provide as much information for you in this period of time. Let me give you an idea of some of the things that you will be doing during this call. We will be answering your questions. You can press 7 on your dial pad. Please press 7 on your dial pad if you have a question, and you'll be talking directly with a screener to put that question into the call. Also, during this call, we will be holding a poll of the people who are online to gauge you on a variety of issues dealing with this current pandemic. So we will give you the prompts on that momentarily. But right now, I would like to turn to Mayor Woodfin to open this call.
Hey, good afternoon, everyone. This is Mayor Randall Woodfin. I want to thank all the young professionals for being on this call. I know we are in unprecedented times, and in times like this, I think over-communicating is very important. So ensuring that all constituency groups can hear not only directly from me, but we can hear from each other and be updated on things. That is the purpose of this. I also like to acknowledge that I actively work with 3 young professionals on the City Council every single day. That's Clinton Woods, representing District 1, Hunter Williams, that represents District 2, and Crystal Smitherman, that represents District 6. I am happy to say that Crystal Smitherman and Hunter Williams are on this call, and at some point I'll give them a few moments to address you all as well. Our intention is to be brief and then open it up for any questions or concerns I know many of you all have. I want to start with current city efforts. Many of you all know earlier this week, through my executive powers based on this health crisis, I instituted and activated a citywide state of emergency that allows us to move a little differently as it relates to making sure we keep people safe. The other thing we've done is have had constant, daily, multiple times a day contact with not only Mark Wilson, who's the head health officer and head of the Jefferson County Health Department, but we stayed in constant contact with the leadership of UAB Health Systems as well. In addition to that, we stay in constant contact with the governor's office as well as our federal delegation that representing us in D.C. All of that to say you all should feel good that there's a coordinated effort, not only from your local elected officials, but from anybody that represents you. We're all coordinated, talking to each other, making sure we find better ways to address and solve for how do we keep people safe and stop the spread of the COVID-19. In addition to that, I want you all to know this. The COVID-19 does not affect all citizens or all people the same. However, it's important that we all treat this seriously and take it seriously. I know there's a lot of notion or talk out there that this affects young people differently and we'll be okay. But I would like to remind the people on this phone that we all have family members. We all have, some of us have mothers and fathers and grandmothers and grandfathers, and we need to make sure the people that are most susceptible to not only getting this, but making it harder for them to actually recover, it's incumbent upon us to make sure we make better decisions and not only taking this seriously, but be intentional about practicing social distancing as well. Now, I know that hits the people on this phone a little differently. Some of you all own small businesses. Some of you all are entrepreneurs. Some of you all work for companies that have already started experiencing the economic hardship that this has caused. And as a city, we're working very hard to address how do we support small businesses, not only through a loan program, but activating the private sector too to match what we're doing with some of our local tax dollars. In addition to that, I think it's really, really important that the people on this phone, I imagine all of you all through some form, shape, or way have influence in your own circles. Please start spreading the word we're sharing, which is 1, practice good common sense. If you're sick, stay at home. 2, practice great hygiene. Continue to wash your hands frequently as well as carry hand sanitizer with you and use it, and watch what you touch, other surfaces that are not in your home. And the third thing, again, can't stress this enough, one of the best ways we can cut the spread of this virus is about being very, very intentional about practicing social distancing. So with that, I want Hunter Williams, if he can say something to share any brief comments he has, and then Crystal Smitherman before we go into any questions.
Thank you, Mayor. I appreciate it very much, and I appreciate you having this conference call or town hall or whatever we're calling it. I think that, you hit the nail on the head when it comes to the health aspects for the difference between how that might affect someone that might be on this call as a young professional and someone that might be of a different generation. There might be a little bit of disconnect about how serious this is. But I think we can all agree outside of the health aspect, from an economic standpoint, this is going to be an extremely serious pandemic, not only for the city of Birmingham and our metro area, but obviously the nation and internationally. Outside of the council, I have for the past several years run a medical business that services hospitals during what you would consider to be, for the most part, an elective procedure. Yesterday, the state, followed by the county health department, just squashed all elective procedures for the foreseeable future in the state of Alabama. So obviously this has a direct economic impact on what I do professionally outside of the council. And I know that my story is probably no different than everybody else on this phone call. There are serious economic ramifications with this pandemic. So thank you, Mayor, for having this, and I look forward to being a part of it for the next however long it lasts.
Thank you, Councilor Williams. Right now, Crystal Smitherman is not on the call yet, but we also have a professional health expert on the phone, and that is Dr. David Hooks, who is the deputy number 2 person in charge at the Department of Health for Jefferson County. At this time, Dr. Hicks, if you could provide some form of an overview and or update for the young professionals on this call.
Thank you, Mayor Woodfin. So I serve as the Deputy Health Officer and also the Deputy Incident Commander for our COVID-19 response. We have over 30 cases that's been confirmed in Jefferson County, with the numbers dramatically increasing. We certainly have a whole lot more, and that's just based on the decreased access to testing, which we are proud to say that with collaboration with our partners in the hospital systems and our partners at the city, we do have a testing site now in downtown Birmingham with UAB, which is going to go live on Monday, in addition to that assurance testing site. The testing has some utility, certainly, to understand the prevalence of COVID-19 in our community and to identify those individuals that are highest risk. But I mirror the comments by the mayor that those recommendations that you've heard about with the social distancing, isolation, following quarantine orders, even, hand hygiene, cough etiquette, those are the things that are going to stop this. I applaud the mayor and then my boss, Dr. Mark Wilson, for taking aggressive actions and leading the state in trying to stop the spread. If we don't take these aggressive measures, the fear is that we will be in the same situation as Italy. We know that China put down extreme measures, and now they're starting to come out of it. Certainly, we understand the deep ramifications to our business community, our young professionals, but this is an all hands-on-deck approach. And so, we are working aggressively to get more testing sites. We are also working to impact the very vulnerable communities that don't feel that they have access to testing. I've been on 2 calls earlier today with church leaders about what is our strategy. I think, so there's, with the partnerships with the city and the economic stimulus packages that are going to be leveraging all of our resources from the private sector, then we certainly, I think, will be able to come out of this. But we're in for the long haul. This is going to be months, and this is going to have a lot of devastating impacts, I think, economically, but we need to decrease and mitigate those effects. And I'm certainly here to answer any questions that you may have. Thank you.
Thank you so much, Dr. Hicks. Ladies and gentlemen, we have one more person to speak before we open it up for Q&A, and that is City Council Representative Crystal Smitherman.
Thank you, Mayor Woodfin, and thank you to my colleague, Council Williams. I really want to commend Mayor Woodfin for really just bringing this communication to younger people, especially young professionals. Guys, don't forget that Mayor Woodfin and the Birmingham City Council, we passed funding for the Birmingham Strong Fund. So if you know any small businesses, nonprofits that need help, or if you need help yourself, be directed to that website. Just reiterating what everybody else has said, please wash your hands, social distancing, encouraging also your parents and your grandparents to stay at home as well, to make sure that people know that this is very serious. Just like what Council Williams was saying, my father and I own a law firm, so we're personally affected by this as well. I also know that Mayor Woodfin and the council were working on getting more testing locations inside the inner city of Birmingham, so just know that we're working and that we're always here if you have any suggestions. Thank you, Mayor Woodfin.
Thank you, Councilor Smitherman. With that, I now turn it over to Rick Journey, who's over communications for the city of Birmingham. He'll guide us through the next phase of this Tele-Town Hall, which is some questions two ways.
Thank you, Mayor. We're going to do something a little different here. Reminder for you, if you have a question for the mayor or any of our other experts on the line, please press 7 on your dial pad. You'll be connected immediately to a screener, and we will follow up with as many of these questions as we can. But we also want to collect some data from you so we can better understand the situation you are in and understand what is happening in our community so we can better serve everyone in our community. So I'm going to ask you a question, and just follow the prompts as we do this. We're going to have about 2 to 3 minutes to do this, and we'll continue with Q&A while we're doing it. Our first question is, during this time, how concerned are you about job security? During this time, how concerned are you about job security? Press 1 if you're not concerned, press 2 if you're concerned, and press 3 if you're very concerned. Once again, the question, during this time, how concerned are you about job security? Press 1 if you're not concerned, press 2 if you're concerned, press 3 if you're very concerned. We will monitor that. You're going to have about 2 to 3 minutes, and while you're doing that, we're going to turn to our questions. The first question we have, Mayor, is how can we help spread the word about what the city's doing?
The first thing everyone on this phone can do is sign in to receive text. So, in all cap, BHM COVID. Again, that's BHM COVID. Text that to 888-777. Again, that's in all caps, BHM COVID. Text that to 888-777. That puts you in a position to be informed with factual, relevant, and updated recent information, and you are in return can share that with your entire network, family, friends, coworkers, and everyone else in your circle. So it's important that you sign up for that so we can give you information. In addition to that, I encourage everyone to share what we are attempting to do, not only for the small business owner, but for the hourly workers. As entrepreneurs on this phone, I imagine some of you all could have anywhere from 1 to 50 employees, so it affects you too, not just on the health crisis side, but on the economic crisis side. Therefore, please take advantage of and or share the website BHAMstrong.com. That's BHAMstrong.com. If you are a small business owner or one of those hourly workers, the more information you can give and share on that website, the more information you arm us with data to share with the state and federal government as we seek to leverage additional resources around not only the small business loan program from SBA, but other ways of leveraging resources outside of what the city can do. And so it's extremely important. Those are two ways. The other thing is this, and that is this. Being on this call, being in a position to share what you've heard on this call, again, is a very simple way. So those are just some quick thoughts about how you can help spread the word. And then the last thing I would say, you have to be intentional yourself. So if it's not your spouse, if it's not your child, use FaceTime more instead of trying to go hang out with someone. We want you to actually go to a park. We want you to ride a bike or walk or run in the park, but we don't necessarily want you sitting in the swings or playing basketball. So being in this position you're in now, still getting out, but watching how you socially interact with people and practice social distance.
Okay, just a reminder once again on our question, and I'll ask it one more time. Thank you for those who have already answered. We're going to close it in about 30 seconds, but the question is, during this time, how concerned are you about job security? Press 1 if you're not concerned, 2 if you're concerned, and 3 if you're very concerned. We'll give you about 30 more seconds to respond to that as we ask our next question. This one, are normal groceries, are they shutting down?
The answer is no. That would never happen. There are certain places that are deemed essential. And so this is a really important question that I want to expand the topic around what type of places have to remain open. Food has been deemed an essential. Pharmacy has been deemed an essential. But I want everyone to consider there are other ways that people get food outside of a grocery store. All of us on this phone, I imagine, know people or are those people that are in various socioeconomic status. So what a grocery store is to one person is what a convenience store is to a different person, but they both serve food. What a gas station is to one person is something different to what a CVS or a Walgreens is to another person. All of those different examples I just named, including dollar stores, including the corner store and the gas station and the pharmacy and the grocery store, all of them in some form, shape, or way sell food. So they've all been deemed essential. So there is never a case where we see closing those because people need access to food.
Okay, our next question deals with street parking. What is being done about tickets? What is being done about tickets for street parking?
So the short answer is people still need to follow the law. I know that's an answer people don't want to hear, but we as a city have attempted to strike a balance. If you put your trash out on the curb, because we are in the middle of a health crisis, you still expect your trash to be picked up. If you have an issue and you call 911, you still have an expectation that a 911 operator is supposed to pick up the phone, in addition to the police responding or a fire truck or paramedic responding. There are always cases where a person gets a ticket and they shouldn't get a ticket, and they're in a position to dispute that ticket, and that option is not being taken off the table. But if you are out and you are out doing any form of business, I guess we still expect people to follow the law. And if that changes, I think we are more than willing to assess or reassess that and let the community know what we're doing with that. But whether it's enforcing parking or enforcing misdemeanors or enforcing ordinances or enforcing felonies, we are, even in the middle of an economic crisis or a health crisis, we still are enforcing the law.
Thank you, Mayor. There is another question, and I want to answer this one fairly quickly. What are we doing to assist with a resource line for older folks? I know that the United Way of Central Alabama has established the 211 line. That is basically for all resources. You can call 211. You can volunteer that way. You can also identify resources that are available for groups and individuals throughout the city. Also, you can organize if you have any resources to offer at bhamstrong.com. So 211 with United Way is a one-stop shop for you, as well as connecting with bhamstrong.com. Our next question and actually before we ask the next question, I have a question for you, everybody listening. This goes back to job security. How long could you financially sustain yourself without income? Press 1 if you could say 2 weeks. Press 2 if it's 1 month. 3 if it's 6 months, or 4 if not at all. Once again, the question, how long could you financially sustain yourself without income? 1 for 2 weeks, 2 for 1 month, 3 for 6 months, or 4 not at all. We're going to be having this question open for responses for the next 3 minutes while we ask our next question, and we'll remind you when we are complete with that. Now let's go to our next question. Stand by 1 second while we kind of go in there and pull the next one up. Okay, our next question is availability of testing for people without symptoms. Will Blue Cross reimburse for people out of jobs? How can those individual employees seek Birmingham? Okay, so this is actually 2 questions. I'll finish it, but we'll come back to that one. For those people without jobs, how can these individuals' employees seek BHAM Strong support? So let's focus on the first question, availability of testing for people without symptoms. A reminder, Dr. Hicks is on the line as well, and he may be able to assist.
Dr. Hicks, I'll let you respond to that first, and I may be the caboose based on the information you shared.
Yeah, so for testing right now, it's the Assurance Lab site that's at the Grants Mill Road, and now the UAB site near the UAB campus, which is going to start Monday. And then we're hopefully to expand testing thereafter. So right now, for individuals that if you're a Jefferson County resident and say you have no insurance, we at the health department are eating the cost. We've offered that to the insurance labs with the UAB site, but they are billing the insurance. Now, initially, the insurance group was doing come one, come all kind of model, and they got overwhelmed. Right now, with insurance and the UAB site, there's not going to be testing for asymptomatic individuals because of the scarcity of resources, and we want to test the people that are the most vulnerable. So there is going to be criteria. So essentially you're sick, which is if you're having fever, cough, and shortness of breath, or you have direct contact to someone who tested positive for COVID-19, that's generally the screening criteria to qualify for testing.
Thank you, Dr. Hicks. Our next question, what special efforts are being made to homeless in our community?
That is a really great question. That is something that's been at the top of our mind for a lot of days. I'm not sure if many of you all saw Michelle Farley of One Roof, which acts as an umbrella organization to be a coordinated effort not only between those who are homeless, but to coordinate with all those service organizations that exist here in Birmingham and the metro area from a coordination standpoint. Just several things. One of the things we're doing for those, there are a lot of men and women who are refusing to come in for help. So what we have already started, we have it, now we have to put it out there, is hand sanitizer docking stations that are on in public right of way for people to use. You don't have to be homelessness to use it, but we believe that will be a great way to help those that are. Another thing we're doing is engaging the shelters that exist in the community, making sure that they actually create a protocol, which they've already did have, for those to use thermometers and any other form of checking to make sure if a person is experiencing a fever or any of the symptoms. Option 1, they can be isolated, or option 2, they can engage in healthcare providers and or facilities to assist that person. The third thing we're doing, again, is staying in constant contact with them daily, and that is through Don Lupo, who works in the mayor's office, around any additional services the city can provide, whether it's additional carts or anything of that nature, if our current sites max out in space, or any other service we can provide to assist those at this time.
There was a question I actually didn't follow up on earlier, and I just want to have a fairly quick response to it. There was somebody asking for those who may have lost their jobs, what can they do with BHAM Strong, or how can they get resources through BHAM Strong? If you go to bhamstrong.com, there will be information and questionnaires there to assist you both from a small business standpoint as well as from those who have lost their jobs. So BHEMstrong.com is an ideal resource at this time. Okay, we have a question pending out there that I'm going to wrap up now. The question dealing with job security: how long could you financially sustain yourself without income? Press 1 for 2 weeks, press 2 for 1 month, press 3 for 6 months, or press 4 for not at all. We'll give you another 30 seconds on that one, and then we will close that question. So that question is going to close in roughly about 30 minutes. Our next question: does the mayor think it would be possible for the youth to return to school, or will the date be pushed further back?
Well, I can tell you what I want, and that's I want our children to return to school. While we're on this call right now, I do know that Dr. Mackey, who is the state superintendent for all 130-plus public school systems across the state, is doing a public interview now, so I'm not even sure what he's saying. I also know I'm in constant contact with our superintendent, Dr. Lisa Herring, where we're providing each other daily updates on what we're both doing, one for her children, students, and me for what we're doing for their families. The third thing is Dr. Mackey has sent information out from his office that he wants to have a call this Monday with mayors across the entire state. Then the last thing is this. I have high concern for our children for several reasons. The first reason is I just want them to be safe. I imagine that they are stir crazy and want to get out of the house. But the last thing we want is a group of children playing at a basketball court or playing outside, roughing each other up, and then bringing it back in their house to their mother or big mama. We don't need that. The other thing you need to be concerned about is just all of us consider on this phone when we were seniors in high school. A month and a half away from high school graduation. We're thinking about our prom. We're thinking about graduation. We're excited about our acceptance letter and wanting to visit a college campus or starting that job we wanted to do or going to the military. All of these things are uncertain right now, and what we have to do is stay in constant contact with them, with their families and parents, as well as continue to talk to Dr. Mackey, who has the ultimate decision to decide what's going to happen with K-12 school systems across the state. In an ideal world, I hope our children can go back to school before this semester is over.
Okay, while we are about to ask our next question, let me prompt you for the next question that we would like to ask you. During this time, have you provided public or community service? Again, during this time, have you provided public or community service? Press 1 for yes, press 2 for no. We're going to keep that one open for about 3 minutes. Our next question: Does the mayor have the power to issue a California or New York-style shelter-in-place order, or does it have to be from the governor or public health?
See how I can answer this question. Most of the time I'm able to say yes and then explain, or no then explain. I'm going to invert that this time and explain first. City of Birmingham, beginning of this week, through executive order, declared a city state of an emergency. That allows me to regulate places from the standpoint of any form of public assembly, any form of businesses, etc., that if deemed this health crisis continues to escalate and people don't voluntarily be intentional about social distancing, then that I do have local power to enforce any and all forms of public places and public businesses to shut down. I do not want to have to exercise that. In addition to that, Dr. Hicks is on the phone, and separate from the city of Birmingham, he can explain the statutory powers he has under a health crisis, and under his statutory power, what the health department is able to do, don't even need the city's permission. Dr. Hicks, you want to speak to that?
Yes, Mayor. So the health officer of the county has the authority to mitigate any health threat and risk, including the ability to quarantine, including the ability to compel questioning regarding surveillance activities, there's broad authority to help mitigate that risk. So as you understand, when Dr. Wilson issued has been issuing his orders, if it's connected to the health of the citizenry, he can do that for the whole county and certain pockets of the county as well. The mayors and city, government officials and even county commissioners also have authority for quarantining. Although typically you think about the health officers doing that, but that can happen as well. We are a state agency, although we are the Jefferson County Department of Health, and we essentially have our own independent board that has kind of independent authority from the state health department in a sense. So that's generally kind of our authority is fairly broad. We actually do collaborate with local jurisdictions. So, for example, yesterday there was somebody who wasn't cooperating with our quarantine order, and so we collaborated with the municipalities, the sheriff's office, to help ensure that person was staying in compliance. We can also mandate people to be quarantined in a facility under guard.
Dropping people, but they're still here.
We apologize. We are having some technical problems here, so we're double checking. Dr. Hicks, if you're still on the line.
I'm still on the line.
Yes, I think we're back. I apologize. We had a hit to our audio system here, so we wanted to double check. So thanks for confirming that for us. We have a question about we need to renew a license, and also will jury duty be canceled? Those don't fall under the realm of the city with the license renewals. I know that the Alabama and Leah announced that they were suspending driver's testing, and they also were going to give a period of time where people they would not, if they were not able to do renewals, that they would be given a grace period. In addition, I know that the courts have suspended in-person court proceedings, so we wanted to address that question. As we continue on, we've wrapped up the last question. Let me ask you the final question we have for you. If you had the opportunity to provide public or community service during this time, would you? Press 1 for yes, press 2 for no. Once again, if you had the opportunity to provide public or community service during this time, would you? Press 1 for yes or 2 for no. The next question, and this goes a little bit to what you were discussing earlier, Mayor, and I think Dr. Hicks can weigh in on this as well. What steps are being taken to prevent people from going out?
I think what you saw yesterday from the state health department is the increase of retail operation in certain aspects. So the less places that are actually open, such as movie theaters, such as any form of theater, such as museums and others, you can stop these gatherings of people, whether strangers or know each other, meeting in groups. That has been a huge step, and all of that has been forward within 1 week. You also saw a decrease in the amount of numbers that people can gather. Last week, this time, it was 250, and then it moved to about 100. A couple of days ago, it was 25, and today it's 10. So what you will see is probably a continued monitoring of if it continues to spread, more measures would have to be taken. Dr. Hicks, would you like to add anything to that if you are still on the phone and or can hear?
Yes, Mayor Woodfin. From the Public Health Department, so we've issued quarantine orders for people that have been confirmed to test positive and their high-risk contacts, which is household members and caregivers of those individuals. And we actually have a quarantine kind of enforcement and inspection team, And so we have a team that is going out to the areas where those individuals are living and doing drive-by just to see if we see people out and about where they may not be. We do get complaints regularly that when community members feel that someone may be violating an order. So that's one piece. As far as businesses, we've actually also driven by just really to see the restaurants and other places if we think that there's gatherings of more than 10 persons more within the facility. So we step up our efforts just to kind of get eyes on the ground to see what's going on.
Thank you, Dr. Hicks. So what we're going to do, the goal is to spend about 45 minutes with you all to try to not only provide you update, but get as many questions and or concerns you had. I would like to leave the last couple of minutes for either Dr. Hicks, in no particular order, maybe I need an order, Dr. Hicks, Counselor Williams, and Counselor Smitherman to close us out if you had anything you wanted to share with the young professionals on this call. Dr. Hicks, you want to go first?
Yeah, so I think for the young professionals, you are leading the new generation, and I think as we're looking to you all you're the next in line. You are in line right now, taking the lead, and I think being a representative of collective community engagement, compliance with kind of the rules, being a good example, I think is very, very important. I think also instilling, not a sense of panic, however, influencing your peers to take this seriously. And as we've talked about earlier, is thinking in the mindset of what is my duty to my city, my town, and my community, my country, and that every single person is vitally important. I will tell you that the very first case that was reported positive in our county, I was the one who received the report directly. I've engaged with that person on multiple occasions, and that one person had multiple touch points through the community, restaurant, healthcare facility, their coworkers, their neighbors. So it takes one person to spread and have this chain kind of link that goes on and on and on. And so, and 85% of individuals that are passing COVID-19 are asymptomatic. And so you could be young, healthy, say, I feel perfectly fine. And you could be that one link that could be connected to somebody dying. And you don't want to be that person. So I think this, you obviously being a young professional, you're already, you have a lot of experience and expertise. You know how to connect yourself and be successful. But I think being a model for the rest of your peers is I think that important message I have for you, and that's kind of all I would say at this point.
Thank you, Dr. Hicks. This is Hunter Williams, City Council. I appreciate, Dr. Hicks, everything that you've had to say and the sacrifices that you're making to continue to serve us in your capacity with the Jefferson County Department of Health. To all the young professionals, of which I consider myself one, and really the whole millennial group, I think that this, outside of 9/11, in which we were probably very young at that point, this might be one of those times that we all remember, and it might be something that defines us as a generation. I think that we have a huge opportunity to stay resilient, to band together to overcome the situation that's been put in front of us. And I think that it's an opportunity for us to show who we are as a generation and who we are as a group, meaning young professionals. I think the city of Birmingham, including Mayor Woodfin, wants all of us to work together to make sure that we are doing whatever we can collectively as a community, both young and old. And I think that the jumping off point and the way to get connected and to facilitate that is through that Be Ham Strong website, which is behamstrong.com. And it has a lot of different avenues how we can either get help or we can give help to the community and to those around us. So thank you all for being part of this. Please join the city of Birmingham in making sure that we as a community band together. I think that we're only going to be as strong as the person next to us. And so with that being said, I'm going to turn it over to my counselor, Crystal Smith, my fellow counselor, Crystal Smitherman, but want to thank everybody for being part of this conversation.
Thank you, Councilor Williams, and once again, thank you, Mayor Woodfin, and thank you all who are on the call. You know, we really appreciate this. You know, I believe we're better, stronger as one than individually or apart. Just remember to be kind to each other. Check on your friends, your relatives. Even though we're doing social distancing, that doesn't mean to cut off contact from people. Don't forget, if you have the opportunity and you have the means to support Birmingham local businesses. You know, there are a lot of businesses, restaurants that we have here. They have families, so even you just getting just a simple delivery or curbside pickup would help somebody out. I do know certain places like Christian Service Mission, they're looking for volunteers. If that's in your heart to do that, just continue to be a good influence. You know, I'm very proud of you all because, you know, it's our time to step up and lead, and this could be the difference between Birmingham just kind of staying still or Birmingham really just being a leader in this country. Support Birmingham Strong as much as you can. Just know that your city officials were there for you, and just keep everyone in your prayers. And thank you again, Mayor Woodfin, for letting us have this opportunity to speak with you.
Thank you, Dr. Hicks. Thank you, Councilor Williams. Thank you, Councilor Smitherman, and thank you to all the young professionals who are on this call. I will be succinct, and I will end where I started, which is please remember these three things. 1, if you are sick, please stay at home, and if you have family in that home, self-quarantine yourself away from your family. 2, practice great hygiene. Please continue to wash your hands as well as keep hand sanitizer on you and wash the public surfaces you touch outside of your home. 3, be very, very intentional about practicing social distancing. All of those 3 things, please share that with your network. In addition to that, I know this is a hard time. I know this is an uncertain time. So please hear me when I say I am more than convinced not only will we get over this, we will get through this, and we will come out stronger on the other end of this. And in this time, we should not only be together, but we should show high compassion for others. And the last thing, very, very important, as Crystal Smitherman said, shop local. Your favorite restaurants still need you, whether it's curbside, walk-in, or delivery. Please continue to support your local small businesses. Everyone, take care, be safe. Look to talk with you all soon and give you a follow-up. Thank you so much.
And with that, I would like to remind everybody that this call will be placed on birminghamal.gov. If you go to the main page, if you scroll down to the bottom, you will find the newsroom, and that's where this call will be placed. If you'd like to do a playback of this or any of the other Tele-Town halls, give us about an hour or 2. It's a large file, so it takes a little while to download, but we will do that. If there are additional questions that you had, but we're not able to get them in on this call, you can press 7 and hold on after this call ends, and you will still be able to leave a message. So press 7 and hold after this call ends, and you will still be able to leave a message, and we will try to provide as much information as we can in the coming days on birminghamal.gov, on our social channels, and on birminghamal.gov/coronavirus. Thank you again for being with us today, and have a good day.
Shout out to all the different organizations that make up Young Professional Organizations. Special shout out to the Rotaract Club. We set up a matching fund to support the efforts of Be Ham Strong. Everyone be safe. Take care.